tough. Okay, let's discuss the question one by one. All right, so without wasting of time, let's come to your first question. So if you can see, the first question asks regarding the clinical test used to check your anterior shoulder dislocation. Okay, so the question is about shoulder dislocation. Okay, so the shoulder dislocation is basically of three types. So one is anterior, posterior and inferior. Okay, so in anterior, the attitude will be your abduction and external rotation. Your posterior dislocation will be of your adduction and internal rotation, and your inferior dislocation, this is your hyper abduction. Okay, right? So the anterior dislocation is your most common type of dislocation. Okay, your posterior dislocation is most commonly seen in epileptic patients or having a seizure history. All right, because the posterior muscles of your main adductor and internal rotator are quite big muscles. Okay, right? And in inferior, the attitude will be of hyperabduction. All right, so in question it's strictly regarding anterior shoulder dislocation. Okay, and last regarding the clinical test. So we'll check one by one. So what do you mean by Dugas test? So the Dugas test basically inability to touch the opposite of shoulder. Okay, so this is called Dugas test. So in case of anterior shoulder dislocation, the attitude of arm will be abducted and external rotation. So it's inability to touch your opposite shoulder. Okay. Your Colway test is basically when you see the vertical diameter of your axilla. Okay. So in case of your anterior dislocation, the humeral head lies over this place. Okay, so it increases. All right, so overall the circumference of your vertically axilla, okay, is as compared to the normal side, it is increases. Okay, so that is of Colway sign. Your Hamilton ruler test is basically when you keep a ruler touching to your lateral epicondyle. Okay, it usually don't touch your acromion. Okay, because of your curvature of your humeral head. All right, but in the case of dislocation, the curvature will be lost and your ruler will touch the acromion. Okay, so this is called Hamilton ruler test. Okay, so this is positive, this is positive, and this is positive. Okay, in the case of anterior shoulder dislocation. So your answer will be all of the above. Okay, your option D. Right. Coming to the second question. The second question is asked regarding your bucket handle type of pelvis injury, and it is due to which type of force. Okay, so the question have basically two components. This is a bucket type of pelvis injury, bucket handle type, and it is due to which force. All right, so to see, let's see this pelvis first. Okay, so what do you mean by your bucket handle? Okay, so bucket handle type of injury, which means your ipsilateral superior inferior pubic rami fracture along with your contralateral SI joint disruption. Okay, so this is called your bucket handle type of pelvis injury. So as you can see, this is the pelvic brim. Okay, so this is the pelvic brim. So it acts like a ring. Okay, so in this scenario, the ring is broken. Okay, So this kind of injury where your ipsilateral superior and inferior pubic rami plus contralateral SI joint